Greetings to all of the participants. I would like to thank AIT and UNEP for this opportunity to speak with you all about healthcare waste management during the COVID-19 pandemic. Let's start our talk in Wuhan. I'll just put this in presentation mode. Wuhan, China was, of course, the first city to experience a massive outbreak of COVID-19. A 1,000-bed hospital shown in the slide was constructed in record time, along with numerous shelter hospitals and quarantine facilities, all of which had to be supplied with massive amounts of PPE and medical equipment, much of it being plastic, as well as packaged food, medicine, and water, and a lot of plastic packaging material. Now, healthcare waste typically contains quite a lot of non-hazardous material, which is potentially recyclable, but it also contains infectious agents, sharps, chemical waste, and may even contain radioactive waste. So unless healthcare waste is safely managed, it poses risks to patients, healthcare workers themselves, visitors, and the wider community. What was the experience in Wuhan? Well, the daily production of healthcare waste in Wuhan increased more than sixfold during the first few months of the pandemic. The authorities in Wuhan did successfully manage the situation with strategic use of stationary and mobile disposal units, co-processing of healthcare waste with municipal solid waste, and temporary licensing of waste haulers to transport healthcare waste safely to neighboring cities for processing and disposal. What about elsewhere? What has been the experience in other locations during the pandemic? Actually, very little published data are available on healthcare waste during the pandemic in other locations outside of Wuhan. A few publications cite this table, which was published by ADB in May of last year. And these figures are sometimes cited as observed trends, but that's not accurate. These are not trends, but are projected increases as estimated by ADB at an early stage of the pandemic. This slide shows some data which I've been able to gather from various sources. The figures in the tables vary widely, and the reasons for such variations are not yet explained. WHO foresees a comprehensive report on healthcare waste during the pandemic sometime next year, 2022, but WHO does not have a good handle on this issue as yet. Now let's do a reality check, because we often hear that 85% of healthcare waste is non-hazardous, but is that always true? This slide shows the findings of a waste characterization study in a general hospital in Vientiane. In principle, 73% of this hospital's waste should be non-hazardous, but because of poor waste segregation practices at source, the non-hazardous portion actually drops to only 50%. And that situation happens quite frequently in many healthcare facilities throughout the region. The mixing of hazardous and non-hazardous waste at source creates an obstacle to recycling of plastic and other materials in healthcare waste. So how much plastic can be found in healthcare waste? Well, a waste audit of 5 hospitals in Philippines and Indonesia by the NGO Healthcare Without Harm in 2019 found that 40 to 70% of hospitals' waste was plastic. That was pre-pandemic. Nowadays, due to the COVID-19 pandemic, additional plastics would be added to the waste stream, including test kits, supplies, and other medical equipment, as well as additional plastic packaging material. Wherever there is poor segregation of hazardous waste from general waste, the result will be that large quantities of plastic are mixed with hazardous waste, and this creates an obstacle to recycling. The photos in this slide are from one hospital in Nepal that overcomes that challenge. Beer Hospital provides a model of successful recycling of plastic healthcare waste in a resource-limited setting. This is based on shredding and autoclave treatment and sale of sterilized plastic waste to recyclers. That sale covers about 40% of the cost of the hospital's healthcare waste management activities. Healthcare Without Harm is one organization that promotes the circular economy concept to address plastics in healthcare waste. This diagram is from one of their publications. One of several challenges to the circular economy approach is, of course, the cost of recycling plastics. There is hope that new technologies may drive down those costs in the future. But meanwhile, the 3 Rs of reduce, reuse, and recycle remain useful strategies to address plastics in either the linear or the circular approach. Now, what does WHO have to say about the topic of healthcare waste management? The publication shown here, commonly known as the Blue Book, contains WHO's authoritative international guidance on safe management of healthcare waste. It covers both routine operations as well as emergency situations, and the guidance is applicable to healthcare facilities at all levels of development, including resource-limited settings. WHO has also issued a guidance note specifically addressing water, sanitation, hygiene, and waste in relation to the COVID-19 pandemic. In short, WHO advises that waste from COVID-19 facilities is no different than waste from other healthcare facilities. There is no evidence that handling healthcare waste has resulted in transmission of COVID-19 virus anywhere. COVID-19 affected hospitals and communities do need to rapidly scale up their waste management capacity, but additional measures beyond WHO's standard guidelines are not indicated. So in other words, follow the Blue Book. Now, among the many challenges that could be mentioned, I would like to highlight only a few. Firstly, many healthcare facilities lack data on healthcare waste quantities and characteristics, and this presents difficulty for planning and management. Secondly, there is indeed, in many instances, insufficient capacity for safe healthcare waste management in the entire waste management chain, not only for treatment and disposal, but starting with collection and labeling, storage, and transport of waste. Third point is that poor healthcare waste management practices were pre-existing in many locations before the pandemic. So this means that all the problems arising from the pandemic are superimposed on top of systems that were already functioning poorly. And lack of infrastructure is not the only challenge. In many cases, healthcare waste policy and regulation is lacking or poorly enforced, and human resources are often in need of strengthening. In my own experience, I've seen in the field quite a number of incinerators and autoclaves that were installed during the avian influenza or swine flu pandemics, or to support immunization programs. And many have become inoperable due to poor operations practices and poor maintenance. I do sincerely hope that the lessons of those failures have been learned. Because in responding to the COVID-19 pandemic, there is a serious need to put in place systems to ensure sustainable operation of facilities over the long term. And that need is fundamental, regardless of which types of technologies are employed. Many recommendations could be made to improve the management of plastics in healthcare waste. I would mention only a few, and these are mainly aimed at hospitals. Firstly, start with plastic audits in order to understand the quantities and characteristics of plastics in the hospital, their uses, how they're disposed, and what may be the options to reduce, reuse, and recycle plastics. Secondly, strictly implement waste segregation at source, because mixing plastics with hazardous materials greatly increases waste management costs and limits opportunities for recycling. Next, review the hospital's procurement policies and practices and advocate with manufacturers and suppliers for alternatives to plastic and for environmentally sustainable packaging materials. And finally, in order to stay up to date with developments and to have access to relevant tools and information, consider joining healthcare plastic recycling networks, such as the Healthcare Plastic Recycling Council or Healthcare Without Harm's Green Hospitals Program. Before closing, I would just like to thank many colleagues who shared information with me to prepare this presentation. Their names are shown here in the slide. Thanks to everyone for your attention. I will be happy to answer any questions.